Now that health care reform is either dead or on life support, many in Congress want to move on to other major agenda items. First and foremost, tax reform. Chief Congressional Correspondent Mike Emanuel has more on that tonight from Capitol Hill.
We've got a lot of other things on our plate here. Tax reform. We need to get to tax reform.
The congressional calendar looks crowded in September. The budget, government funding to start a new fiscal year October 1st, reauthorization of a flood insurance program, and the debt ceiling are all expected to be addressed then. The budget blueprint is being worked on in committee now.
Balancing the budget by 2027 is a top priority. Our national debt stands at $20 trillion, with $9 trillion added over just the last 8 years.
That budget is critical so tax reform can be passed in the Senate with a 51-vote threshold instead of 60. Reworking the tax code is expected to be written in the fall, and the goal is finishing it by the end of the year. GOP leaders are out selling it now.
We need to go for growth. That's what we want in this tax code, up and down the line, and lowering rates for Americans, regardless of where they're at, is pro-growth. We do this right, I think we unlock the economy in a major way.
Some sources suggest infrastructure could be an October priority.
We're a country of infrastructure. Speaking of infrastructure, that's what the president said. He goes, I'm going to have the biggest infrastructure bill you've ever seen. Well, where is that?
GOP sources say the debt limit could very well be tied to a bill funding veterans' medical care outside the VA system to make it more appealing. Senate Majority Leader Mitch McConnell would like to address the borrowing authority soon.
Ideally, we would deal with the debt ceiling before the August recess.
And House Speaker Paul Ryan has added welfare reform to the list of priorities to be addressed by the end of 2017. Some are worried about the slow pace on the other side of the Capitol.
Over in the Senate, there's been a lot of obstruction and just slow movement. And, the Senate really needs to think about some of the rules over there.
The compressed calendar is increasing tension among lawmakers, some suggesting all the time spent on health care reform has been a disaster, unless, of course, they get it done. Brett?
Mike Emanuel live on the Hill. Mike, thanks.